All right, so as a typical man, I am impatient, and we are going to get started. Um, Today, I want to start off by covering the certification process. Many of you, we got an opportunity to meet many of you actually about 2 weeks ago. Everybody had a couple of weeks off from our conference calls, and with 4th of July and the way that the holiday was coming through, we really did have an opportunity at FAIA to meet a bunch of you. So it was really nice to put names and faces together. People actually got to understand that I do exist. I'm just not a voice somewhere, and same thing with Giggy. And so that was great. It was really nice. Got a good opportunity to talk to a lot of you. Now, what we're ready for now is really getting ramped up and prepared for our next AEP, OEP, whatever you want to call it. Depends on who you talk to, what kind of answer they're going to give you. And step one of that is going to be to get your certifications done. Now, the certification on the federal marketplace, the screen that you see right in front of you, I'm going to actually put the web address in the address bar. Now, what I need everybody to do is make sure that you get to this website and you complete your certifications. Now, you are going to want to, and here's where some notes come in. You are going to want to make sure you're using the exact same login ID that you were using last year. You don't want to create a new one. And you want to make sure that you're doing that because this login ID has to meet and has to match the identity proofing that you completed last year. You will not have to do the identity proofing again unless these things are different. And we really don't want to make sure we make this as easy as possible. You know, the government has made a lot of things complicated. Let's try and use something that they're making easy. Use your same login ID. Hopefully that you have that written down. Once you get into this system, then you want to make sure as well that your national producer number is in the profile. If your national producer number is not in the profile and you complete the training courses, you will have to redo them because that national producer number has to be placed there before the courses are started and before you complete them. So it's very important because you will have to do it over again. I know internally in our agency we had 2 or 3 people that had to redo it 2 or 3 times because they didn't pay attention and didn't listen. So I'm recording this call so you guys can, obviously reference it again. Again, let me say that one more time. Your login ID needs to be the login ID that you used last year. Okay, the password can change. So as long as you know the login ID, you could always hit forgot your password, shockingly enough. Once you get in there, you want to make sure that you check your profile, make sure that your national producer number is listed in the profile, and then you can complete the testing regimen. That is up there and available for you to complete. I think it was there yesterday or the day before, but now that we know it's up there, we know that you can access this, we want everybody to go into that and get it completed. Definitely try and do that in what I would call non-productive times. Get it done, in the afternoon and the weekends, whenever you feel like sitting there and learning a little bit about the new marketplace. Now, this is not going to be product specific. This is going to be really geared around the rules of enrollment, who can enroll, what are minimum essential benefits, bronze, silver, platinum, gold. Has nothing to do with plan specific or product specific areas. Those will be released. Those are going to be released in a Skillsoft and or a Gorman, and you will also have to upload your certificates at some point in time. It's not available yet, but get this done. When you get your certificates, save them as a PDF. Let me just make sure I repeat that. Save those certificates as a PDF so that way as soon as Blue Cross releases and says to us, you are able to do your enrollment now, and we're going to have that direct link like we did last year. You just have to upload your certificates. You can get that done. Now, those of you that did not complete Part 1 or Part 2 last year, newer agents to the organization, people just joining us, well, welcome. You are going to have to do a 3-step process. There's a document that we can send out to you if you did not register last year. If you have agents that were not working with you last year and now they're going to be in this market, they are going to have to complete Step 1, 2, and 3. Now, anyone who has not completed a marketplace certification will not be able to sell any SEP business for the rest of the year. So, for example, you're just starting with us, you just got going, you talking to somebody, they have an SEP because they got a divorce, I don't know why I picked that as my first one, but if they were getting married, much more pleasant in the morning, maybe. So if they're getting married, they have an SCP, you would not be able to enroll them unless your 2014 certifications were completed, and that needed to be done last year. It's too late. Closed, shop closed, no longer can do it. All right? So I would advise everybody getting through this. If you forgot your login ID, you could always do a forgot login ID, but get this done as soon as you can. Get those certifications out of the way so you're not having to worry about it in the near future. Does anybody have any questions about this certification process? Wow, is everybody awake this morning? Fantastic. Um, Okay, so let's move on. We are still waiting for some guidance on the auto enrollment and rollover processes that Blue Cross and the government are going to be utilizing. Some of you that are and have been paying attention closely to the news, the administration had made a statement about a week and a half ago, that they were going to allow people to keep their 2014 plans, not roll over to a 2015 plan. If you've heard that chatter, don't be alarmed. We've heard it as well. What we are waiting for is guidance from the carriers on how they're going to administer that. It's kind of what the administration has done several times when it came to grandmothering, grandfathering, nieces and nephew plans that we had. When it was purchased, when you can keep it. The administration comes up and says you can keep your plan forever. So what does that actually mean? In the eyes of the government, it's a great political stand to say you can keep your plan, but from the administration of that, from a carrier perspective, that becomes a little bit more difficult to do, especially when, from an actuarial standpoint, they were planning on everybody moving from one year plan year policy to the next. That's where our plan numbers come in effect. Is if you recall from our training last year, 1424, it's a plan year 14, and the plan is 24. So now this year, all the plans will start with 15, and then they will have a respective number after that. We're not sure how the auto enrollments or the rollovers are going to work, how much involvement is going to be needed by you, the agent, and or the agency, how much customer service is going to be involved. Will you have to go and recertify your income and go back to the marketplace and do all of that mumbo jumbo again? Nobody knows. There's no guidance out there. So if you're scratching your head thinking you're missing something, that this has been released, how come we don't know about it? Nobody knows. Drips and drabs of what's going to happen, but no clear direction. So be comfortable with that. As we look at the new product line, as we're talking now a little bit more about the Affordable Care Act, we are going to have a much more precise and smaller portfolio to work out of. Now, some of you may say that that's positive. Some may say that it's negative. We want to have the selection. Well, what we've done as a carrier, the carriers looked at the plans and what the enrollments were, and there were really a bunch of plans that just didn't have any real participation. And that's always been that way with underwritten plans throughout the years. There's always a handful of, a 596 or a 96 plan, which many of you may not even know about, or, we had other plans that were out there floating around that just is never sold. So what you're going to see is a smaller portfolio, but you're going to see a much better direction on enhancing an A, B, or C plan, and that's something that you should be really excited about. Just enhanced benefits on those A, B, and C plans in the silver metal level. Very exciting to see what those plans are going to look like. I've kind of seen a little bit of them, but unfortunately, we can't release any of that information that is going to be out there until the carrier says we're good to go, and we can start learning and educating about it. But know that those products will be very attractive. So when you're talking to your clients, a lot of clients that we're speaking to now are saying, well, what's going to happen next year? What are we going to be looking at next year? An enhancement of the benefits. A lot of people are, looking at, are the deductibles going to change, or my drug copay is going to change? I don't know. I mean, deductibles are probably going to change like they always do. But from a perspective of our subsidized clients, one of the things and the reason why I'm talking about this is because if your client is subsidized, that policy premium is not going to change. It's just going to be a benefit. Now, if they are unsubsidized, of course, there is going to be increase in premiums and different things like that. But we're not going to be sure of the direction because that client may be able to keep that policy. And then we're also going to, as a carrier, have to deal with what is the rate increase on that 2014 policy going to be, because there was not an expectation that that plan was going to be even out there. A lot of moving pieces, a lot of things that are changing. So it's a very exciting time, and I'm going to advise everybody on this call, as well as all of the people that you work with within your agency, to be on every one of these calls moving forward, because as this information becomes available, we can make sure that we talk to you about it, we inform you about it. We want to make sure that you're informed and making sure that you are the most educated agents and agencies that are out there in the industry. All right, so let's talk a little bit about a payment issue that has arisen, and this is where I really need everybody to again take some notes on it. Um, we have all had a major amount of issues that have come about when it comes to payment. I know that everybody has. And if you haven't, that just means that you haven't spoken to enough of your clients to identify that these issues are out there. What has been identified is the way that the grace period is working is really adversely affecting all of the people that we worked with. So I really want to take a minute to explain it. I didn't have an opportunity to map it out in a form of a document. I've seen some documents that are out there that don't really explain it very well. So what I'd like to do is talk to you about it and then give everyone the opportunity to ask questions. So let's talk a little bit about grace period and termination of a policy. What's going on right now is that if a bill is generated for a client, and that bill is generated somewhere around the 15th or the 16th of the month, that bill is sent out to that client, and that client needs to pay that bill by the first of the month if they're not on an automatic payment option or an APO. If that policy is received by the carrier on the second of the month, that payment is late. I think we'd all agree on that. Even though it's not the American way, that payment is late. Now, that enters that particular client into their grace period. Now, month 2 rolls around. And during month 2, well, that policy, they get their bill again. They send it in on the 2nd or send it in on the 30th. It doesn't get there till the 2nd or the 3rd again. Well, now they are still within the grace period, but we are in the 60-day grace period of that policy in month 2. Well, now they get their next bill, and as a typical American go, we send it in on the last day of the month. They get that on the 2nd or the 3rd of the month, and now that policy premium is late as well, and now they are in the 90th day of their grace period. So what you need to understand is that until they make an on-time payment, they will remain in the grace period. It makes no common sense, absolutely. So before everybody starts typing and saying that makes no common sense at all, I agree. Everyone agrees. That's not the problem. The problem is that that's the way that the government is administrating the payments, and that's the rules that we need to follow. So let me tell you where the really interesting or the confusion comes into play. If I make my first payment, my binder payment, obviously on time, I make my second payment on time, I make my third payment, and my third payment is received on the 2nd. Well, that's a late payment. I receive other payments. If I make one other payment and it gets there on the 1st, it has to be there before. It has to be there on or before that date of the 1st in order for them to get out of that grace period. So some people will make one off-cycle payment, miss a payment, and then just kind of dribble them in, but they never get any of them in on time. And they've identified this of over 11,000 people that have been terminated their coverage because of this, call it a glitch or an administrative fiasco. Because it was never identified, it was never communicated, and no one had any idea about it. Blue Cross was on a call with us yesterday, and that's basically how they delivered it to us. So it's a nightmare, but we have to make sure that you are getting your people out of the grace period. Because if they're in the grace period, they make one payment, then they say, oh, well, I'll make the other one, on the 2nd or the 3rd of the month. They're still in the grace period until an on-time payment and all payments before have been caught up. They will remain in the grace period, and they will be terminated, and they will send back all of their money. So, rule of thumb is get them out of the grace period, make sure they get caught up on a payment, and the payments have to be made and received by the carrier before or on the 1st. So, now I'd like to open it up for questions. Is my computer working today? Giggy, can you hear me okay? Okay. All right. Great. So when does the grace period end to where the policy will cancel? 90 days. The 90th day is the last grace period available. So as long as they make an on-time or early payment before the 90th day, they will be out of the grace period. But all other payments must be made. Okay. So that's not as alarming to everyone as I anticipated it was going to be, because it was very alarming to me, to our organization. So as long as everybody is comfortable with that, we're good to go. Any other questions regarding that grace period and how that grace period is working? Okay, perfect. Let's move on a little bit then. When we're talking about Medicare, we are going to be in. Oh, here comes a whole bunch of questions now. Let's see. Can the policy be reinstated? Absolutely, the policy can be reinstated. There are some parameters to which that reinstatement must be done. We are waiting for final guidance on that, but you must be able to prove that those payments were sent in, and then those policies will be reinstated. Blue Cross is currently looking at reinstating 11,000 of those policies almost in an automatic situation. So that way they're looking at them, identifying them, and reinstating those policies. But if you do have someone, Teresa, that was affected adversely by this, collect all of your data. You want to make sure that you contact agent services and talk to them about the reinstatement. If they are not eligible for reinstatement according to agent services, you can also send that information to Giggy, and then we can bring it up to the area manager to make sure that it does get reinstated. It is so new as of yesterday of this identification that agent services is not going to be educated on all of this, but you can see a lot of that information as far as when payments were made, when did they receive those payments, and a good honest conversation with your customer should clear that up. Is there a same procedure for non-subsidy policies? Absolutely, Brian. Great question. For non-subsidized policies, or what we would call off-marketplace policies, exactly the same applies because the billing rules have to be the same. The only difference is they only have a 30-day grace period, making it a much more likely situation for them to be terminated. Now, to get those reinstated, we would follow the same process. Blue Cross is looking at adjusting and making some business rules about how many of those reinstatements will they allow and some different things like that, which they'll communicate. However, in today, get that information to Giggy, contact agent services, and, obviously we'll try and get and resolve the issue. Off-marketplace grace period was supposed to be 30 days and 60 days for the market. Maria, I don't know where you heard that. It's 30 days for the off-marketplace, and it's 90 days for on-market. That hasn't been adjusted from my knowledge. Does this affect non-marketplace plans? Yes, it does, as I'm just kind of going over that now. Is there any leeway for mail issues? I had a client send a payment in on the 23rd, mail destroyed and returned to the client. No, there's no leeway. It's a late payment. If the payment is received late, then they are going to have to make that second payment if they're in the first day of their 30-day grace period, that first section, before they get into the 60th grace period or the second phase of that grace period, they have to make the next payment beforehand. So let's just say they sent it in on the 23rd. The mail room destroyed the payment. They get a new payment out to them on the 1st. Blue Cross receives it by the 5th. They need to make sure that they immediately send out their next payment so it gets there before the 60th grace period begins. So if the payment was made on the 89th day, it won't cancel, or does the payment have to be on time before the grace period ends? Maria, I'm not sure if I understand this question. So what you have to make sure is that to make sure the policy does not cancel, all premiums in that 90-day window have to be caught up. And there cannot be the ability for that policy to be late in that 90th day. So they would have to make up all of the payments before, and I would advise getting the other payment in on time, because the one on-time payment is what gets their policy out of the grace period. That's what you have to remember. The one on-time payment gets them out of the grace period. Is an auto payment considered on time if they scheduled it after the first? Well, they can't schedule a payment. There's no way to schedule a payment after the first. If they are scheduling a payment, then I would assume you're talking about through their lending institution bill pay, such as Wachovia or Chase. And if it's not there after the first, excuse me, then that's not acceptable. What you want to do is advise all of your clients to be on APO. We have always used APO, and that was our only choice because no one wanted to pay 2 months worth of a premium at a time. So what you want to do is make sure that every one of your clients is on an automatic payment option to avoid this issue. That is the problem, is that, we as Americans, I know me, myself, my life insurance premium comes out of my account automatically. I don't watch it. I don't make sure it's coming out of there. It just comes out of there. Your policy premium for your health insurance should be set up on an APO because, as we've identified, probably 85 to 90% of all of the issues that everybody's having is related to payment and is related to on-time payment and these people going into situations such as no claims payment because they didn't mail the payment in until after the 16th. Because as you know, after the 16th of the month, we're not paying any more claims until we get payments made. All of these issues that you're dealing with customer service, or at least most of them, are revolving around the payments. So we need to make sure, get their payments in on time, need to be there on or before the first of the month. And we also need to make sure that if that's not going to be something that they can do, get them on an APO and make sure that they're utilizing that APO. Technically, the latest day to make a payment in order the policy not to cancel would be on the 60th day or the first of the month before the 90th day. I'm not quite sure I understand this. It needs to be only payments are always due on the first. Okay, I answered it already. Never mind. So make sure that the payments are always there before the first, on or before the first. And it's not, I dropped it in the mail on the first. It's postmarked on the first because, well, we all love our U.S. Postal Service, but we know, as the other question came through, that they destroy mail and there's all kinds of things there. Unfortunately, get them on an electronic payment option, and you have to make sure that it's set up. All right, David's asking a good question. What happens if Blue Cross doesn't withdraw the auto pay? Well, that would happen the first time, and then after that, you need to make sure that auto pay is picked up and selected. Make sure that it is corrected and if it's wrong in the system. But if Blue Cross has the auto pay information, you have confirmation that they have the auto pay information, reference numbers, and things like that, then you will be able to address that, and those policies will get reinstated. As many of you know, we have had auto pay problems. So as they've resolved most of them, most of the APOs that have been set up within the last few months have not had any issues, and they are withdrawing fine. But if your client needs to be monitoring, as we've said for months, monitoring that APO is actually drafting, because it's only once they do it the first time and the second time in month 2 or month 3, they should not have any issues with that at all. Does a client know about the policy being canceled if they continue to stay in the grace period? Well, I believe it's in their contract. However, they're not going to know until they get all their money back that the policy is canceled. Blue Cross didn't even know that this was going on, and that's why we're talking about it before anybody else is released. You haven't gotten an agent service bulletin that really described this. A couple of the area managers sent out some communications yesterday about it, which was not very clear, and that's why it was very important that we talked about it today and spend as much time on it as necessary. They will know that their policy is being canceled when they get their cancel letter. They'll know that this is happening when they get the information that they have a late pay. So there's mailed communication, but that's really all they're getting. And that's where, a good constant contact with some sort of email marketing tool or some sort of normal communication with your clients is going to be necessary. We are also asking for some information from Blue Cross that we'll see if we can get to provide you all with, so that way you have a way of looking at, who do you need to talk to about getting these things set up. Um, let's see. Is any of this being changed to have common sense? That's a great question, Bill. It's actually it's not commonsensical because the government designed the rules. So unless the government redesigns the rules, we have to follow the governmental rules. And from what I'm gathering, a lot of this is related to how they pay per member on these subsidized applications. So I don't think it's ever going to make common sense. But when you really think about it, it's just a matter that they've got to pay on time. And so many people just don't pay their bills on time. So we just have to make sure that we're talking to our clients. We say, hey, you've got to pay the bill on time. It doesn't matter. You got to put it on APO. This is just the way that it works. Somebody put it in perspective yesterday. Said, well, what would happen if they put your house in foreclosure, for missing or making a late payment every month? Well, guess what? You'd make your payment on time. It's the same kind of thing here. They've got to make their payments on time. As much as I want to stomp my feet and clap my hands and say, woe is us, this is no good, this is horrible, listen, it's common sense. You got to pay your bill on time. If someone doesn't have the means to do it, they can, do something. They have to do something in order to get that payment done on time. It really isn't too big of a deal when they're in month 1 of the grace period to make their second payment, but when you get to the 90th day, that's when it becomes an issue. Or when you've got somebody who has had major issues with the marketplace and they've been waiting 90 days to even get their policy or be able to pay. Give you a good example is we had a lady that signed up for a 5/1 effective date. She still hasn't been able to get her ID cards or pay. Now she's going to have to pay 5/1, 6/1, 7/1, and 8/1 in order to keep her policy. And think about that. So 5/1 is what her policy. She enrolled in a policy on, I think it was 4/15 or 4/18 with an SEP. She wasn't able to pay on her policy for her 5/1 effective date. She has just got her bill yesterday to pay on her policy because they didn't have her in the system. Now she's going to have to make the first binder payment, no problem. The second payment, okay, we can make that too. But now, if she doesn't make the third and fourth payment by the end of this month, she's going to be outside of the 90-day grace period. They're going to send all of her money back, and she's not going to have a policy. And it's by no fault of her own. Okay? Let's see. Is Blue Cross going to release any information to our clients on this issue, at least with the monthly billing statements? What they're looking at is communications, is looking at how they're going to communicate this from the carrier to give better clarification. I spent a lot of time with Blue Cross helping and working with them, identifying some of these issues and trying to, see where the problem is. They have to figure out how they're going to communicate it in a clear messaging because as you can understand here, it's not very clear. Basically what you need to communicate to your clients is a bill needs to be made on time. You can look in search accounts and see if they had a late payment, and if there's consistent late payments, you're all getting letters. Those letters should be coming to you about late payments. Those are the people that you want to talk about. The habitual late payment people are the ones that are really the issues. And that's where, they will get reinstated. The first time pretty much is going to be a no questions asked kind of situation. The second time they're going to research it a little bit and then they'll go from there. After the second time, they probably won't do that. Has anyone reviewed any of the new 1,400 pages of regulations released on Friday with the reference to us and the Affordable Care Act policies? No, I have not. I know that there's a whole bunch of regs that were released based on billing, based on how doctors need to be billed, and a whole bunch of things like that. But I have not had the time. Ms. DeFalco, have you had the time to read those 1,400 pages? Oh, Giggy read them, so you can give her a call. So, I'm sure the legal team at Blue Cross has read them and is diligently trying to figure out how they're going to make sense of it. All right, So, unfortunately, that's the way that the billing is working. That's what we have to deal with. Clear communication to your clients. If you're late on a payment, you better get that next payment in there before it's due so that way you can get out of that grace period. They can go in and out of the grace period as long as they make that on-time payment, but my advice is if you identify a client who is in the grace period, Mr. and Mrs. Jones, let's avoid all of this headache. I want to make sure that if something happens to you, you don't have to worry. Let's put you on an automatic payment option. There is a document in the form center that you can fill out, and that can be sent to membership and billing. You can also call HPS through their 1-800 number and speak with a representative to set that APO up. If you do set up APO, my advice to everyone is to do it via paper. And with that paper, keep clear fax confirmation sheets. Keep a copy of that information in a file. So if something should come up and that APO is not set up, that it is that you have all of the documentation to prove it. What we're finding is a lot of people, they just don't even know. They don't look at those, their statements. They don't look at the line items, and this is what's causing a lot of problems, especially for the folks that it's a $20 or $30 policy. But we have had clients who there have a $1,400 a month policy and calls me and said, "Hey, you terminated my policy. I didn't realize you weren't taking it." Well, that made me feel really bad, but I was like, okay, great. If I was missing, if I had an extra $1,400 in my account every month for 3 months, I think I would have noticed. But these things happen. All right. Any other questions on the payments issues, the reinstatements? Blue Cross is doing an outbound campaign to talk to our clients about this. They are, trying to reach out to them to explain this. There are going to be letters and other communications, and as we get more information on that, we'll let you know. All right, so want to tidy things up with a little bit of Medicare talk. We have a lot of things to be excited about with Medicare. There have been some deficiencies when it comes to Medicare, and the area managers will be communicating any issues that you may be having with your team. A lot of you that haven't worked in the Medicare market are really going to need to pay attention for the next few months to these calls. We'll be releasing some training materials, and so there will be some SkillSoft materials for you to get ready and get understanding how Medicare works, the rules around engagement, around enrollment, what are your enrollment options, and then of course, finally, the product. So a lot of things with Medicare and the regulations that come behind Medicare. It's very important for you to pay attention and take your time. There's timing issues, there's certifications, there's things that you need to understand. It's not just for everybody. So I say that because when we're looking at a focus with your agencies, with your teams, as you're talking to your teams about focus, a lot of people say, I want to do Medicare, I want to do Medicare. Just be very conscious about your selection of team members and how you do it and what you're going to be doing for marketing, the investments that you're going to be making, because it can be a cumbersome process and it's not the same as under 65. So we will be working with you to make sure you're well educated. There are going to be some special programs for those that are focused in the Medicare arena, special certifications for anyone who is going to be doing a presentation. There's going to be a special certification for that under Blue Cross. These are going to be senior specialists, so not just anybody can go and do a seminar or do an educational event or things like that. All right, and lastly, I want to talk to everyone a little bit about getting involved with your social groups. I know that I've mentioned this probably on every call, but getting involved with different areas from marketing in a more grassroots arena is going to be very important to make sure that you are starting to do that now, and making sure that you're talking to people and getting engulfed in the community, different senior communities, different different religious groups, or whatever you may be focused on. If you have a bridge club, or you're in the Elks group, or who knows, whatever you may be doing in a social aspect that you have a sphere of influence on, you really want to capitalize on. That's a great way for you to really build your business for what you guys are doing now, whether it's PNC or other areas. Life insurance, or even just focusing on the health, Affordable Care Act, unaffordable. You notice that was a little Freudian slip there. The Affordable Care Act, as well as the Medicare policies. All right. So before I let everybody go today, I want to welcome everybody back. Summer is here, but we are going to be doing a lot of education. Does anybody have any questions regarding billing or any of the things that we talked about today? All right. Well, everybody, I'm a couple weeks off. I'm sure it was very nice. I hope everybody had a great 4th of July with your families. We'll be picking it up again next week and then every week thereafter. If there's any areas of concern, please let us know about, let Giggy know about your concerns so that way I can address them on the call as well. Um, Somebody's now asking a question about commissions as everybody is banging out of the call. We don't know yet. We've heard rumors of an increase in renewals, but we don't have any clear information yet. As soon as that information is available, we'll make sure that we let everybody know because we're waiting for it just like you are. So. All right, everybody. Well, thank you for your time today. This will be recorded because there was a lot of information. Giggy will have it in the Dropbox for you and your team members, and I want to thank you for your time. Please remember to get all of your team members on these calls if you can, so that way we make sure everybody's educated as best as possible. Thank you, and have a great day.